Hello, everyone, and welcome to our first webinar of our free summer webinar series, where we'll explore a screening brief intervention referral to treatment tool that we developed here at the Higher Education Center that we call ScreenU. My name is Cindy Clouner, and I'm the Managing Director here at the Higher Education Center, and I'm so happy that you're all joining us today. Before we begin, I just want to move through a couple of housekeeping things. First, if you have any questions, you're welcome to ask them throughout the duration of our webinar. You can do so by entering them into your question box on the control panel on the right-hand side of your screen. And with that, we'll go ahead and jump on into our webinar today. And so as we explore ScreenU, we'll also talk a little bit about what SBIRT is and give you a crash course on the basics of SBIRT. We'll take a look at both the student and staff experiences through ScreenU, and I'll talk a little bit today about how campuses are implementing the program. So first, let's start with what is SBIRT. So SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. So SBIRT is an evidence-based strategy that's supported by organizations like the World Health Organization and the Substance Abuse and Mental Health Services Administration as a means for early identification of people who may be struggling with their substance misuse. And so there's a few components that are pretty key to the implementation of SBIRT. One is that it's brief. It's meant to be relatively short, particularly the screening portion of it, and the entire process is intended to be shorter than what we typically a person may typically move through for a standard treatment. The SBIRT is intended also to be universal, so it has its greatest impact when it's implemented universally within a population. So here on our campus, if we're targeting a specific population, it would work best if we implement SBIRT with that entire group, whether that's the subpopulation or all of our students on campus. SBIRT is encouraged to be implemented in non-substance use disorder treatment settings. And so it has historically been done in healthcare settings, such as emergency rooms or in primary care offices. And we're encouraging campuses to think broadly about how they might be able to implement SBIRT outside of a traditional setting. It's historically also been done one-on-one, typically, with a provider that's been trained in motivational interviewing. So SBIRT goes through a process that we've kind of illustrated here with an image that we're borrowing from the Hilton Foundation that looks at the process in which a person would move through SBIRT. So it starts with a screening, and those screenings, again, are typically brief, asking questions that identify the risk level of an individual. And depending on their risk level would determine where they go next. So if they don't have any risk for a substance use disorder or making low-risk choices related to their substance use, then that would reinforce positive behavior for them, the healthcare professional that's working with them. If they are at a higher risk, then a healthcare professional would ask additional questions and assess their level of use to determine whether it's most appropriate for them to receive a brief intervention that could be as easy as just some quick education. It could be multi-step intervention that includes more than one session, or it could be a referral to treatment for those who have the most severe use. As I mentioned, SBIRT is an evidence-based strategy that's been shown to reduce use, specifically the quantity and frequency of alcohol use among a number of populations, including college students. And so SBIRT's been shown to reduce the typical blood alcohol content and peak blood alcohol content of college students, the number of drinks a student consumes in each setting, the average number of drinks per week, and the number of drunk episodes. And the body of research around SBIRT is much more significant as it relates to alcohol use, but there is a growing body of research that shows that it can be effective with other substances and has been shown to cause an overall reduction in substance misuse, including the frequency of marijuana use. So although SBIRT has historically been done in person, there's some challenges to implementing in-person SBIRT, particularly on a college campus. And the first is that it requires training. So as I mentioned, it's delivered one-on-one by a clinician trained in motivational interviewing. And so that training obviously takes time. And once you've trained a staff member, if they've moved on, then you have to retrain a staff member. And so there's resources that are related to the implementation of in-person SBIRT. And because of that, it can be time intensive. You're working one-on-one with someone, even though it's relatively quick. You are limited in your capacity when you're delivering services on an individual basis. And because of that, it can be hard to implement on a large scale. So I'm sitting here on Ohio State's campus. We have 60,000 students. It would be pretty much impossible to deliver in-person SBIRT to all of our students. And even on smaller campuses, that would be incredibly challenging to deliver in-person SBIRT. And so the model for standard SBIRT can be difficult to implement in a universal way with all college students on your campus. And because of that, those challenges and looking for a way to address them, the Higher Education Center developed ScreenU. And so we're going to spend the rest of our webinar today exploring ScreenU and talking about how some of our campuses are currently utilizing the tool. So there's a few benefits that we think are really great about ScreenU. As I mentioned, it's web-based, and so students can take it with as long as they have access to the internet. All they need is a link to their screening to be able to complete the screening. They don't need to download anything on their phone or their tablet to be able to utilize it. It's also anonymous, and so ScreenU collects only 3 demographic points. We ask students their class rank, their gender, and their age. We don't collect any other personally identifying information as part of the screening process, allowing us to maintain anonymity for those that are completing it. It's brief. A ScreenU from start to finish takes about 5 to 10 minutes. Obviously, our students who are at lower risk, it is much more brief. But those that are at higher risk, it may take a little bit longer. Either way, the average student moves through the program in less than 10 minutes. It doesn't require any training to implement, and so we're going to walk through it. You're going to see how simple it is, and because it is delivered in a web-based way, it doesn't require a staff member to meet with students to be implemented. One of the things that we like the most about ScreenU is it connects students with vital resources. All of your campuses have resources available to students, both on your campus and within your community. And I'm sure many of you know students who spend their entire 4 years on your campus without ever knowing how well supported they really are and all of the resources that are available to them. ScreenU allows you to upload resources that are important for students to be aware of within your campus and community, and connects them at the end of the screening, putting those resources at their fingertips. ScreenU also provides real-time reporting for those of you who are administering the program, and I'll be exploring what the reporting looks like as part of our webinar today. And finally, there's a few customizable elements that we'll explore as well that allow you to tailor ScreenU to your campus. So how does ScreenU work? Well, we've done our best to model the in-person method of SBIRT as best as possible while delivering it in this digital format. We have 3 programs with ScreenU, one focused on alcohol, one focused on prescription drugs, and one focused on marijuana. And all of them use pretty much the same process that students would move through as part of the screening. So they start with a gateway question. They move through the full screening if they indicate that they're at risk based on that gateway question. Once they've completed the screening, they receive feedback based on their risk level, and they'll begin the brief intervention portion of the program that asks open-ended questions, simulating the motivational interviewing process. And finally, students are connected to strategies to reduce their risk, as well as resources that are local to their campus and community. In the past year or so, we've updated the ScreenU user experience. So we've been on the market now for about a year. Prior to that, we did a one-year pilot with 20 campuses across the country who gave us feedback on the experience, both from a student user experience and from a campus administrator experience. We were able to integrate that feedback into some updates, and we launched a newer user experience last fall. And so those of you who haven't explored ScreenU since then, hopefully you'll be happy with some of the changes that we've made. One of them is a new icon-driven user experience. So one of the things we heard from you is that it was just too text-heavy, and we agreed. And so we created it, and the whole platform looks different from our initial program, utilizing icons and imagery to be able to convey messaging wherever possible. We also know that most students are taking this on a mobile device, whether that is their cell phone or a tablet. And so it was important that ScreenU was fully optimized to allow the best experience for students. And so the entire program is mobile friendly. We also know that one of the frequent asks was, well, can we test out a campaign without it collecting our data just to get an idea of what it looks like? And we implemented that for campuses with this most recent launch. And so now you'll be able to take a demo campaign, click on that link, review the screening tool to make sure that it looks the way you intend it to look, share it with stakeholders who are interested in learning more about ScreenU without your data actually being collected in the reporting and potentially skewing your data. And finally, we made some enhancements to the identified student features, which is a method for deploying ScreenU, and I'll be talking about that in a little bit. So now we're going to dive in to the student experience and take a look at what a student would see. Now, what I've done is grab some screenshots of a alcohol screening. We'll talk about some of the features and what it would be like for a student to move through this, but I wanted to let you know that anyone who is interested in actually moving through a demo screening, we will make those screening links available to you after the webinar. So as I mentioned, we have 3 programs: ScreenU Alcohol, ScreenU RX, and ScreenU Marijuana. We're exploring ScreenU Alcohol as part of this student experience. And the first thing that a student will see once they click on the link is a welcome message. This welcome message is customizable by campaign. And your campaign is just a grouping of screenings that you send out to students. And so this campaign, the message that you're seeing is our default content, but you have the ability to adjust this content depending on who you're screening and what department is utilizing the tool. You'll see that we collect 3 demographic points, as I mentioned before: gender, class, rank, and age. And I just wanted to share some details about the types of selection options that students have when it comes to gender and class rank, because that's a common question that we get. So once students provide us with an option for gender, their class rank, and input their age, they're ready to begin the screening. As I mentioned before, we start all screenings with a gateway question. For ScreenU Alcohol, we use the audit, the Alcohol Use Disorder Identification Test. And for this tool, it looks at past 12-month usage of alcoholic beverages. And so we're wanting to know if a student has consumed alcohol in the last 12 months. And depending on how they respond to this, we'll determine where they go in the screening. So if a student indicates no, that they have not misused alcohol in the past 12 months, they're going to move to a screen that gives them positive reinforcement for that choice. And then it also includes some information where they can be linked to resources around low-risk guidelines for alcohol consumption, as well as what to do if they're concerned about a friend's misuse. If a student indicates that they're in recovery, then they are directed to a page that is populated with recovery-specific resources. And so again, these resources are populated by your campus and community. And so you're able to identify the most appropriate resources for your students who are in recovery. So this is a great place to make sure that students are aware of a collegiate recovery program that you might have on campus. You see here the information about our own collegiate recovery community here at Ohio State. It's a great way to connect them with support groups that are happening either on campus or within the community, but also professional staff and their offices that can help support them. If you don't have a collegiate recovery program, that's okay. We encourage all campuses to identify what we call a recovery ally, which is a person on campus that is aware of the recovery supports and can help link students to them. You don't necessarily have to have a collegiate recovery program or a formal support system for students to be able to help connect a student who is in recovery or seeking recovery supports to those. And so we encourage all campuses to identify a recovery ally. Of course, if a student indicates yes on that gateway question, then they're going to move to the full screening. And so we have adopted the audit as the screening tool. We use their questions verbatim as well as their scoring system. There's about 9 questions that they would move through. There's 10 total in the audit, but one of those is our gateway question. And so after students move through those questions, then they receive feedback based on their risk level. And so the page that we're exploring is indicative of a student who has scored high risk or likely dependent. This page will be different for a student depending on the risk level that their scores indicate they are at. And so as part of the feedback for a student who is at high risk, we outline examples of high risk drinking behaviors. We also look at some of the effects of high-risk drinking, the impact that it might have on judgment and reasoning, muscle coordination, and our ability to concentrate. And because of the high-risk likely dependent level that this person screened at, they also received additional information outlining some behaviors that are particularly problematic, that if they're experiencing these, they would want to seek help from a treatment professional. Once a student moves through the feedback page, then they begin the brief intervention portion of the screening. And so for this part, they have 3 open-ended questions that are intended to elicit change talk. We want them to start thinking about why they might be wanting to change their drinking behavior and what benefits that might have. And so these open-ended questions are open text fields that students can type in their responses. They're required to type in at least 10 characters before they can move on to the next question. And there's a series of 3 of them as part of ScreenU alcohol. Once they do that, then they move on to our readiness scales. And so for the readiness scales, we look at how important it is that the student feels how important it is for them to make a change, how confident they are that they can make that change, and how ready they are to make a change. And using a sliding scale from 0 to 10, they can indicate those levels. And so we start with the importance scale. And so for this example, we indicate that we're at an 8. And then after they respond to the readiness scale, then they have additional open-ended questions that are reflective based on their score that they gave themselves. So we indicated it was an 8. Our open-ended question is an 8 sounds like it's pretty important to you. Who's been supportive of you in the past, and how can they help you? So students have an opportunity to respond to this open-ended question in the text box. I should mention that all of these open-ended responses are actually captured in our reporting CSV. And so you're able to see the open-ended responses that students provide to these brief intervention questions. We continue this for confidence and for readiness. So they move through all 3 scales with reflective open-ended questions after each one that they receive, each of them a little different based on the score that they gave for that scale. And finally, a student receives resources that can support behavior change, as well as strategies to reduce their risk of experiencing negative consequences related to that. And so what we're looking at here is the resource page for a person who is at high risk. This resource page differs depending on the risk level. And because this is at high risk, then we put extra emphasis on speaking with a helping professional. And so we've identified those folks here at Ohio State's campus, and we've listed them within our resources. And so you're able to expand by clicking on that plus sign. It'll open up and show us the location of those resources. You can include a brief description of what the resource is, what kind of services they have available. You can link their phone number and their email address and their website so students can link with them directly to be able to begin taking advantage of their resources. Below that are suggestions that students can use to help reduce their risk of experiencing negative consequences. And so there's about 12 of these tiles. I'm sharing 6 of them here. I'll be sharing a few more on our next slide. So we're looking at low-risk guidelines related to alcohol use and strategies to avoid high-risk drinking, so avoiding shots, as well as avoiding drinking games, making sure that you eat while you're consuming alcohol, alternating alcoholic and non-alcoholic beverages. So these tiles provide students with strategies to reduce their risk of experiencing negative consequences. Again, because we identified, this person was identified as being at high risk based on their responses to the questions, then they also are connected to, again, our Recovery Ally and other recovery supports if they're interested in seeking those out. The last thing a student receives as part of ScreenU is a thank you page. This thank you message is also customizable by campaign, so you have the ability to change the content on this thank you page. Students also can download, print, or email that resource page that we just saw to themselves, as well as a certificate of completion. They can do the same for that to be able to show that they've actually completed the program. One of the other things that I want to share with you is the mobile experience. And so if a student is taking this on their cell phone, which is very common for most of our students are probably taking the screening on their cell phone or on a tablet or another device that wouldn't be as large as their computer or laptop, and take a look at what that looks like. So we put a lot of care in making sure that students would be able to utilize the tool no matter what kind of device they were accessing ScreenU with. And so if you were to take a look at the links for a ScreenU and even make your web browser window shorter, you would see that it's going to adjust to that size. So here's about the size of a cell phone, what students would see as they're answering questions. Those changes to the mobile experience have been adapted throughout the entire screening. So we're taking a look at a confidence scale here, as well as the open-ended responses, or open-ended questions, I'm sorry, in response to the confidence scale. And again, that resource page that we're talking about. So students are still able to clearly see all of the information, even on a smaller device. I'd like to jump in and talk a little bit more about what it would be like from an administrator perspective. So those of you that are joining us on this webinar, you're here as representing your campus. Most likely, you may be the person tapped to oversee the ScreenU implementation on your campus. And so this is what our dashboard looks like for campuses. So you can see it's a top-down view of the data that we've been collecting as part of our the campus campaign for ScreenU. The data that we're looking at here has been collected through our demo dashboard. So you'll see towards the top of the menu, the Higher Ed Center logo. So that lets you know that this is our demonstration dashboard. That logo would be replaced with your institution's logo on your dashboard. And so the teal data is representative of all of the data that we've collected campus-wide through this program. Of course, our demo data that's been collected because we've had screens sent to campus professionals just like yourself who are testing out the program. So that teal data isn't representative of student data for the program. However, the gray data so the gray data is national aggregate data from all the campuses who are using ScreenU currently. You'll notice on the left-hand side is the menu for ScreenU. So these are all the tabs, and we'll talk through most of these tabs so that you're aware of the different features that are available on all of them. And then at the very top right-hand corner, you have the ability to control your account details. So resetting your password, updating your email address, and logging out. The Manage Campus page is available to anyone who is considered a campus admin. And so that's part of one of the roles that are available for users that are implementing ScreenU. So as a campus, you can add as many other professionals to the program as you're interested in, and you can assign them one of two designations, a user designation or a campus admin designation. Campus admins have the ability to control who the users are on the program and what the departments are, and have the ability to renew the program, where a user has the ability to create campaigns and adjust resources as needed. They also are able to view reporting. And so we encourage campuses to add more than one user to the program so that it can be implemented in a more widespread way. The other piece that's available is identifying departments on your campus that you can implement ScreenU within. And so by identifying departments, you can limit a user's access to certain campaigns. So for example, if you are screening your student athletes, maybe you create a department called the athletic department, and you add users to that athletic department who would be appropriate to create campaigns or view the associated reporting for the campaigns that go to your student athletes. That means that anyone else on your program that is added as a user that isn't associated with the athletic department would not have access to that information. Now, we've already talked a lot about campaigns. Campaigns are really the bread and butter of our program. And so a campaign is a grouping of screenings that you can deploy to students, all with the same features. And so the create a campaign process happens in about 5 easy steps. And so we're going to explore those steps here. The first step is just some of the general information about a campaign. What do you want to name your campaign? What program are you using? What department should the campaign be associated with? And then a start and end date for the campaign. So when you identify a start and end date, the program is going to automatically activate and deactivate based on that start and end date. The name of the campaign is important so that you can keep track of this campaign and make sure that it's not getting confused with others. You can easily identify it in your list of campaigns as you start using the program more widespread on your campus. But one of the things that's most important at this stage is to really think through what kind of data you want and how you might want to use it. That's important because, as I mentioned, we only collect 3 demographic points. You can drill down in the reporting using those 3 demographic points, but that's it. So going back to our student athlete example, if you're interested in screening all of your student athletes and you're really just interested in general student athletic data, then creating a campaign for student athletes would be sufficient. But if you are really more interested in perhaps if you have some teams that are at a higher risk of negative consequences from substance misuse than others, then creating a unique campaign for each athletic team may be a more appropriate way to go. So you may have a campaign for women's soccer and men's basketball and so on. So that is important to do at the very beginning of your campaigns because there wouldn't be any way to do that retroactively once students start completing your screenings. So just want to point out the department piece again. That's really nice and a newer feature for us, allowing you to segregate data and ensuring that only campus professionals that should have access to it do have access to it. As I mentioned while we were exploring the student experience for ScreenU, you have the ability to customize the welcome and thank you message. And it's step 2 of the campaign building process that allows you to do that. So on step 2, you'll see at the top here the welcome message. If we were to scroll down on our page, we would see where you could edit the thank you message. And this is really great to do by campaign. Again, using our student athlete example, you may want to add something in your thank you message, encouraging students to reach out to their coach if they have any questions or concerns. You can do that here in this in the welcome and thank you message boxes. The next couple of steps are really focused on how we actually administer the screening and how it's deployed. And so there's a couple of ways that campuses have deployed ScreenU. One of them is to take our web-based link and distribute it to students through your own university's email system. So that works great. Another option is to put that link on a promotional item of some kind, a poster, a hot card, or an actual giveaway, and give that to students. We've done campaigns like that here at Ohio State a number of times. We just wrapped up a campaign where we put a screening link on posters and we added some incentives to it. We collected over 2,000 screens that way over a few month period of time just by hanging up posters around campus. Another campaign that we did here at Ohio State about a couple years ago was putting the link on portable phone chargers, and we passed those out to students. We were able to collect about 600 screens with that campaign. So we encourage campuses to think out of the box when it comes to getting the screening in students' hands. Of course, because it is a web link, it can be hyperlinked on your student wellness website or your counseling center website. But another option for deploying the campaign is what we've been calling our identified student method. And so with that, we identify a group of students that would be receiving the screening. We can upload their email addresses. The program will identify and create a unique collector link for each of those students that will then be emailed to them through the system. What that allows us to do is to track whether or not they've actually completed the program, which is really great, particularly for campuses who are implementing this in a conduct setting where they may be mandating the completion of ScreenU. It's important for me to note that although we can track their completion, at no time are those email addresses linked to a student's responses. And so even using this method, a student's responses maintain their anonymity. So what we're seeing here in step 3 of this is the email that you would be sending out. Again, this is customizable, so you can change this email to say whatever you would like. We have some default content here that you can use, but you should change it to reflect the purpose of your campaign or any other pertinent details you want students to know about why they might be completing ScreenU, why it is important, and any directions that they should be following related to that. Step 4 is looking at the actual uploading of those email addresses and providing those to the system. So you can do that a couple of ways. If you have a CSV file, which is a lot like an Excel file, then you can upload that file here. We have a template available for campuses to download to use that will allow you to put their email addresses en masse into the system. You can also manually enter email addresses. So if you have them in another file somewhere, you can copy and paste, or if you're sending it out to just a handful of students, you can use this method as well. Once we've done that, then the emails will go out to students. Once the campaign starts, we're able to take a look at an overview of our screening details. That includes that demo URL that I mentioned before. So we see the type of program that we're using, the title of our campaign, which we titled Fall 2018. If we were to have identified students, we would see their email addresses under that current students added list. And then we see the links that we would use to explore ScreenU to make sure that it's looking the way we want before we send it off to students. And then the campaign URL, which is the screening link you would use to actually collect the data from students. At the end of a campaign page, you have a few other options. So we're able to add additional students to those identified screening links. We're able to send reminders. If a student hasn't completed the program, you can send a reminder to all of those students automatically through the system. We can download that identified student CSV that's going to show us their email, their unique collector link, and a timestamp of when they've completed it. We can also make updates to our email templates that we've sent out. Another big piece of the program is our resources and making sure that the resources are ones that are appropriate for students, that they'll find useful, and that they best meet the needs of our students. As I mentioned before, so often students don't realize how many resources are actually available to them on campus, and then you can compound that with what might be available within the community. And so the program allows you to add resources that are local to you, and you would do that here. So you see, you would add resources that are specific to a certain program or specific to students in recovery, but you also have the ability to add those resources to all of those programs at one time. And so we encourage campuses to think through all the different kinds of resources that are on their campus, not just those that may be alcohol and drug related specifically. We have identified about 10 different resource categories that when you go to add a new resource, you'll be able to see those from a drop-down menu. It's not required that you include resources from all of those categories. In fact, we only have a few that we encourage campuses to ensure that they have a resource for ScreenU to function at its peak. Those resources would be a student wellness or health promotion office, student health, counseling, support groups, and study skills. And then, of course, if you have a collegiate recovery program, we encourage you to list that as well. If you can identify a resource in all of those categories, even if your student wellness may be a piece of another program, it's just important that students know who to reach out to if they're interested in making change related to their use or changing other behaviors that may be impacting their use. One of the last things that have to do with the administrative experience that I want to explore with you today is the reporting. So you can look at reporting in a few different ways. One of them is by campaign. You can look at just one specific campaign. You can look at it by campus. So of all the campaigns that you've collected, this is the data. You can also look at two campaigns side by side. And so when you go to campus reports, this is what you'll see. You'll be able to identify the program that you want to look at, identify a start and end date in which you want the reports to be filtered by. We can leave that blank if we want to look at the lifetime campaigns that we've collected here, or we can add some dates. So maybe we want to look at just spring semester from this past year. And then you'll see a number of graphs once we provide that information. And so here is the first one. It looks at screenings over time. So it shows us when we've been collecting screenings and how often. So you see that our account has been active since October of 2015 and when we've been collecting screenings. You can also take a look at, of the students that we've sent those identified screening links to, how many of them have been completed, how many of them are still outstanding. And of course, the overall risk level of a campaign. So in this case, we're looking at for our entire campus over the lifetime of the campaigns that we've been screening for, what the overall risk level is. And so when you hover over top of one of those pie pieces, you'll be able to see both percentage and the raw number for a risk level. We can take a look further at the overall demographics of those who have responded to the screenings we've put out through our campus. Here is our gender chart. Again, if you hover over a bar, you can see both the raw number and the percentage. That continues for all of our demographic points. And then we also look at how students responded to each of the questions in the screening. And so you can see the pie chart looks very similar. Again, you can hover and see the percentage and the raw information. But one of the other things that we think is really nice is you can click on a pie piece and it'll expand and show you the demographic data for that particular response. So right now we're looking at that kind of marigoldy color, I guess, and it's 2 to 3 times a week is the response associated with that. So of the 69 people who indicated that they consume alcohol 2 to 3 times a week, the vast majority of them were female in this response. Much less of them were male. You would be able to see those responses for all of the demographic points if we were to continue scrolling down. Of course, again, just a reminder that this is all testing data. It's not representative of actual student data. So we're able to do that for all of our questions. We also offer a CSV available that allows you to follow a screening from start to finish to see how students responded. That includes the open-ended responses that I mentioned before. Of course, that CSV is de-identified, so it does not have any of the demographic points that we mentioned. It only has the actual responses to the screening. So I'd like to spend the rest of my time exploring how some of our campuses are using ScreenU, and then we'll certainly leave some time for questions. If you have a question, I encourage you to send it now in your question box. We'll respond to those once we finish up talking about how it might be implemented on your campus. I provided a couple of examples of things that we've done here at Ohio State. Those initiatives have been headed up at Student Wellness, but we've implemented ScreenU in a variety of other settings here at Ohio State as well. And ScreenU is currently being used in 50 campuses across the country, all of them implementing it in a different way. And so during our pilot, we were able to learn a little bit more about how people were using ScreenU and some of their lessons. We'll be sharing a couple of those with you today. And we're excited about kind of launching a new endeavor this fall where we'll explore more deeply how people are using ScreenU to help develop some best practices for you, depending on the types of environments or populations that you may be interested in implementing ScreenU with. So we know that there are campuses currently using ScreenU in their student health services, with student wellness, in their fraternity and sorority life through student conduct, as well as screening higher risk populations like first-year students or athletes, and as part of orientation programs. Of course, this is not a comprehensive list, and we encourage campuses to think outside of the box when it comes to how they might be able to reach students. I think our gold standard is for campuses to consider screening all of their students on a regular basis. We know that we focus so much on first-year students, and rightfully so, but oftentimes, unless a student is a part of a high-risk population, once they're past their first year, they may never engage with your campus again around alcohol-related initiatives. And so ScreenU is an opportunity to quickly and easily touch base with them, put those resources at their fingertips, help them identify their risk level, and encourage them to make change if necessary. So as I mentioned, we have a few campuses that use it in clinical settings, and some of them are using it in their waiting room in student health services or in their university counseling center. They either use a community tablet or they provide a link so that a student can complete it on their own device. And we have had a couple of campuses that actually incorporate some follow-up with a person, a clinician, once they complete that. So once they meet with their clinician in their room, they can either self-disclose their risk level for further conversation. A provider can ask if they want to have a conversation or if they have any questions about the screening they just took. They can also provide that by email on that thank you page, as we mentioned. We have quite a few campuses who implement ScreenU in the conduct setting, and that looks differently on every campus, but some of the things that we've learned from campuses who are implementing it is we have a number of them using it to triage students, to be able to identify those that are most at risk versus those that maybe have a lower level sanction who are presenting at a lower risk, to be able to determine what the best, most appropriate course of action that would benefit the student would be. So a lot of your campuses are probably using programs like basic basics, which is fantastic. We know that that's an evidence-based program that works for students who, particularly for students who have been identified as having some negative consequences related to their misuse already. But those of you who are using basics know how resource intensive it is. For it to be most effective, you meet one-on-one with a student 2 times for an hour each time, and that takes a lot of time from those of you that are in your office. If that is the standard protocol for all students who have an alcohol-related violation, that might be too much for some students and not enough for others. And so ScreenU could potentially be an opportunity to identify the appropriate intervention that best meets their needs. Most of our campuses are doing it in advance of meeting with a conduct officer. And so those screening links might be included in a letter that is sent to them, or we also have campuses who use that identified student method to be able to send it off to students to complete and be able to track whether or not they actually have done that. And then because our resource page is different depending on the risk level, conduct officers can utilize that resource page to determine the risk level and make appropriate recommendations. Here at Ohio State, we've screened our student athletes for a couple of years now, and we had a really successful campaign with them where we gained some buy-in from our athletic department as well as our coaches. We have a great champion over in our athletic department for ScreenU, and so they were able to rally the troops. We were able to send out an initial email with a screening link that came from the athletic department. Coaches sent a follow-up email to their teams, reinforcing the importance of this. And at that time, all of our athletes were required to take an educational program on marijuana, and they used the ScreenU certificate of completion as their entrance ticket to that marijuana training. By doing that, we had 100% completion among the teams that were screened. But we also think ScreenU can just be a tool in your toolbox. And so academic advisors should have access to ScreenU, and they can deploy it with their students, particularly those that they may have concerns about. With residence life or fraternity and sorority life, it can be a risk management tool. We have a number of faculty who have implemented ScreenU by adding it on their class syllabi or offering extra credit for completion. Of course, it can be linked on your website and used on promotional items, as we've mentioned. And so with all of that, I, again, want to encourage you to ask some questions. I see that they're coming in. We'll do our best to answer all of those before our time is up. Any questions that we don't get to, though, we'll make sure we'll get you a response, and we'll post those on our website so that everyone can see what those responses are. But I imagine many of you are asking, okay, well, you've talked all about ScreenU, but tell me more about the nitty-gritty, the important stuff, like is there a cost associated with it? And there is for ScreenU. So the Higher Education Center moved to a membership model about a year ago, in which we've rolled up a number of our benefits to make them available to campuses, ScreenU being one of them. So a campus membership is available for $2,500 for 1 year, calendar year access. That gives you unlimited access to all 3 of our ScreenU programs, as well as technical assistance to help your campus get up and running. Campus members also have some additional benefits that aren't available to some of our other membership levels. One of those is access to our Recovery Ally training materials. So it is a 1-hour training geared for faculty and staff around how to support students who are in or seeking long-term recovery and how they can serve as a recovery ally on their campus. It also explores ways to reduce stigma of people who have substance use disorders. And so the materials that go along with that training, both the curriculum, a PowerPoint, as well as a Recovery Ally sticker that can be printed for those that are in attendance, is available to our campus members. Our members also have access to our learning collaboratives, which are a series of web-based trainings, both those that have happened in the past and those that are happening currently during their membership. So we've completed 3 learning collaboratives, one focused on cannabis, one on collegiate recovery, and one on prescription drug misuse. And we're excited about launching one in the fall, focusing on how you can engage your peers in prevention and recovery efforts on campus. Learning collaboratives are available outside of memberships, but they're one of the benefits of an institutional level membership, such as our campus membership or our ScreenU membership. Hopefully you've heard about our conference coming up, the national meeting taking place in October here on Ohio State's campus. So membership provides you with a discount to that. And of course, you have access to our free resources as well, our weekly newsletter called the U Report and our free webinars like that we're doing today. So what are some next steps? Well, if you're interested in learning more about ScreenU, I encourage you to visit our website at screenu.org. We have a 7-day demo account that you can register for. It allows you to explore the account from the campus administrator perspective. We're also happy to share sample screenings from all 3 programs so that you can actually walk through a full screening of what a student would see and respond in a variety of ways to see how the screening might differ depending on your risk level. If you're interested in moving forward, I encourage you to email us at screenu@osu.edu. We can provide you with those sample screening links and help walk you through the steps of getting ScreenU on your campus. Once you've made the decision to move forward, there's a few things that you can do. One is gathering those key stakeholders on your campus, identifying where you would like to implement ScreenU. The next step can be auditing the resources that you have on your campus, pulling those all together, making sure that they're adequate and appropriate, and getting all of the information that you need to input into the program. And then creating an implementation plan. So when will you be screening students? Who will you be screening? And what is the frequency of that screening plan with those students? And of course, here at the Higher Education Center, we're here to help you through any of those steps if you're interested in moving forward. Okay, so with that, we're going to answer some questions that you have submitted. If you have any other questions, I encourage you to submit those now. I'm hoping that we can get through all of these today. We have a couple other announcements that we want to share as well. So the first question is there a ScreenU version specifically for mental health or only substance use? That's a great question. So right now we only have programs specific to substance use. We have ScreenU alcohol, marijuana, and prescription drugs. There are screening tools out there, though, of course, for depression and other mental health issues, and we encourage you to explore those as well. So we had a question around studies about marijuana and screening brief intervention, and if we can refer you to some studies. Absolutely, we have some research on our ScreenU website that you can take a look at, and we can include a link to those studies in our follow-up email to you. As I mentioned before, the body of research is much stronger for alcohol, and we know that SBIRT is most effective with people who have not yet developed a substance use disorder. And so that's some of the challenge with implementing SBIRT with substances like marijuana or particularly illicit drugs. But there is some studies that show that there can be some benefit to implementing SBIRT with people who are using marijuana. So we have some questions about the specific screening questions. So the question is, why is 1 week not an option in terms of one time a week not an option? I think in terms of the questions that we're asking as part of the audit, and then also looking at some of the low risk guidelines that we've put out. So the screening tool that we are using is the audit. It's the alcohol use disorder identification test. It was developed by the World Health Organization. It's a validated screening tool, and so we felt it was really important to maintain the questions as they're written and the responses as they're written. And so that's what we did in terms of the screening tool. In terms for the low-risk guidelines, we modeled our low-risk guidelines after the low-risk guidelines that NIAAA uses. And so that's where the information that we're providing as part of low-risk guidelines comes from the National Institute on Alcohol Abuse and Alcoholism. Karen asked, what's the average length of time it takes to complete ScreenU? So as I mentioned, it takes about 5 to 10 minutes to complete ScreenU. It actually is really brief. Of course, that differs depending on the program that you're in and your risk level. So particularly for prescription drugs, our ScreenU RX program, we know that the vast majority of students are not misusing prescription drugs. And so most of them are going to screen out at the gateway question. They're going to say no, that they're not misusing prescription drugs. And for them, that's about it. They're going to say no. They're going to receive some positive reinforcement. They're going to be linked to resources if they're interested on their campus, but they don't have to go through the full screening. Students who are at a higher risk, they're going to move through the full screening. It's going to take a little bit longer, but even those students complete the screening within 10 minutes time. We had someone ask about a QR code, if you can generate QR codes from the web links, and absolutely. So you can use a QR code generator that you find online to be able to take the web link that we provide for a screening and use it for a QR code. It is just a normal web link. Granted, it's a very long web link if you were to actually type it out on your own, but a QR code would be a great way to be more efficient in terms of students accessing it. In fact, we encourage, if you're just providing it to students for them to then take on their own device without actually sending it to them in a web-based format, that you use a URL shortener to make it smaller. We have a means of doing that here at OSU where it can still be an OSU-specific link, but campuses that don't have those means can do that by using a Google URL shortener, for example. Another great question, can you implement all 3 programs at once, or is it one per screening? It is one per screening. There are some tricks to having students move through all 3 of them at one time, but I encourage campuses to be thoughtful about how they're engaging with students, and it may not make sense to send students through all 3 of them at one time. It may make more sense to offer them throughout the year for multiple touch points with students. That depends, of course, on the population that you're screening and the purpose in which you're screening them. So there's a workaround that you can use to give them access to all of them at one time, but they aren't actually all put together in one screening. They would have to click on all 3 of those links. So we've had some questions around evaluation of the efficacy. So we're really interested in working with some campuses to evaluate the efficacy of ScreenU and how people are using it on their campus. We know that SBIRT is an evidence-based strategy. We know that it works on college campuses. We've modeled ScreenU after SBIRT and the foundational principles of it, and we're interested in taking the next step and doing more evaluation of ScreenU itself on campuses and how people are using it. And so with that, we just have a couple of more minutes. I know we have a couple questions we didn't get to, and we'll make sure to respond to you offline and post the responses to those questions on our website. But I wanted to make sure that we got a chance to give you a couple of announcements, some of which are time sensitive. One of them is our Generation RX grant. It's a mini grant opportunity that is done in partnership through both Generation RX and the Zeta Tau Alpha Foundation. And so this mini grant application is available right now. You can learn more about it on our website. It is 5 $1,000 implementation grants that are awarded for next academic year to help promote safe medication taking practices through educational programming, and it should be delivered in partnership with a wellness or health promotion office or staff, and your fraternity and sorority life department. So campuses are tasked with providing 10 programs to campuses to their students, 7 of which should be focused on students who belong to the fraternity or sorority life groups on your campus. And those grant applications are available now, as I mentioned, on our website. And the grant period closes on next Friday, June 1st. So it's a pretty simple grant application. I encourage you to apply if you're eligible, and we'll be making those awards in mid-August. Again, grants are due on June 1st. I mentioned the national meeting during our last a little bit ago. And so I just want to put another plug in for the national meeting coming up October 15th through the 18th. It's at the Blackwell Inn and Conference Center here at Ohio State University. The early bird discount ends June 30th, so you have one more month to register at our early bird rate. If you are a member of the Higher Ed Center, either institutionally or individually, you receive an additional discount on top of your early bird discount that makes registration only $300. Registration includes breakfasts and lunches, and it's an excellent conference for anyone interested in working on collegiate alcohol and drug prevention, intervention, and recovery. And so with that, I just want to thank everyone for joining us today and giving us an hour of your time to learn a little bit more about ScreenU. Again, I encourage you to reach out if you're interested in taking a deeper dive, want to talk a little bit more about how it could be implemented on your campus to complement your current prevention efforts, or if you're interested in taking a look at some of those sample screening tools that we discussed. And I also encourage you to connect with the Higher Education Center. So visit our website at hecaod.osu.edu, or visit our social media on Facebook and Twitter at HECAOD. This webinar has been recorded and will be posted on our YouTube page and our website early next week. And with that, I just want to encourage everyone to have a safe and happy Memorial Day weekend. And I look forward to speaking with you soon. Thank you.